Welcome to another episode of Healthcare Connections podcast, powered by Healthcare Compliance Pros. I am your host, Jeremy Winn. Our purpose for this podcast is to introduce you to key topics and experts in the healthcare industry to ensure you have what you need to successfully manage your practice. Please subscribe and follow us on our social media channels to make sure you don't miss any new episodes. If you have recommendations for guests or topics for this podcast, email me at jwin@hcp.md. With that, enjoy this episode of the Healthcare Connections podcast. Hello and welcome to this episode of the Healthcare Connections podcast. I am your host, Jeremy Winn, the Director of Sales and Marketing here at Healthcare Compliance Pros. We've got another awesome guest for you with an amazing, what I think is a really unique and cool and amazing business model. So I'm excited to introduce you to Shannon Seeberan. Did I say that right? I should have asked you.
Seeberan.
I had that right. Okay. She's the co-founder of Cloud Med Spas. So welcome to the show, Shannon.
Thank you. Thanks for having me. I love your podcast. I've listened to quite a few and excited to be here.
Thank you. So why don't you give the audience a little more introduction to yourself? Tell your story and how you founded Cloud Med Spas and what led you up to that.
Yeah. So my background is in healthcare consulting, primarily working with private practices, helping them with their flow and efficiency, really working directly with physicians. I'm a daughter of a physician who owned a private practice for years. So really connecting with our clients, my clients, and understanding what they needed from a business perspective, and the inability of a lot of physicians who just wanted to offer the best patient care and run their practice, their ability to look into the future and figure out what is, what could benefit their practice, how could they get their employees more invested in the growth of their practice, the inefficiencies that were currently plaguing them. It was an awesome space to be in and a huge value add to my clients. About 5 years ago, I met the founder of our company, Iggy Fanlow, Cloud Med Spas, and got really excited about what solution our company was bringing to the healthcare marketplace from a shared space perspective. And so that's what I'm excited about to talk about today.
I'm really excited for everybody to learn about this. As I said in the intro, and as I told you when we kind of chatted before, I love this model that you've built. So let's start first, because there's kind of two sides to the coin here and people that you're helping. But let's start with those that have some space, right? That you call them space owners.
Yep.
I love that. So let's talk about how you help the space owners and how they can benefit from partnering with Cloud Med Spas.
Great. And when we talk about space owners here, we're really talking about a diverse array of space owners. They could be in the medical specialty, health, anything in the healthcare specialty, dentists, orthodontists, physicians, nutritionists. So when you think of how the healthcare wellness space has expanded today, our platform really provides a great solution to a lot of different space leasers or owners in that marketplace. So practitioners who've taken over the ownership or the lease holding of their primary practice in theory. So, shared space is not a new concept. It's not something we've invented, but bringing something to the marketplace that helps our clients implement a shared space opportunity. It has been, obviously we've seen a great response and a very positive response from our clients, who a lot of physicians I talk to say they've been considering or even implementing space sharing opportunities for a while, but they've found it problematic with other, coming up with the process and obviously the logistics themselves. So our platform really implements all of the opportunity for them and for them to truly maximize the space sharing opportunity at their location.
I love that. Are there certain specialties that you're seeing come to you and partner with you that are having the most success, or is it really all across the board? I'm just curious.
Yeah, it's really all across the board. However, specific space leasers or owners that are in the aesthetic space, whether it's a dermatologist, whether it's a med spa, that is endemic to who our biggest renter is. So the users of the space, who tend to be large majority of the renters of spaces, tend to be independent aesthetic practitioners, primarily nurses who are injecting medical aesthetics, which, as you know, in lay terms, those are fillers, things like Botox,
Mm-hmm.
offering non-invasive aesthetic procedures to their patients. This marketplace has truly taken off. As a lot of people know, it's a very lucrative marketplace, and practitioners are really looking to tap into the marketplace, practice independently, and reap the benefits of these services themselves. So they're looking for spaces versus taking on that capital risk and investment themselves.
Yeah, I love that. And one of the things that we talked about, maybe you can speak to this a little bit, is, we hear it here from our clients, but there's a lot of groups that are trying to add wellness or aesthetic into their practice. And this gives them an alternative to where, if you don't understand that business, if you don't want to take on necessarily the liability of having to figure all that out and add it as part of your business, this gives you the flexibility to still collect and capture some revenue from the industry without taking on the liability. Maybe speak to that a little bit.
Yeah, correct. It's a great opportunity for patient growth, especially in certain practices that are looking to scale location as well. A lot of our clients have multiple locations. A physician or a dentist cannot be in all three locations at the
Mm-hmm.
same time. So they have locations that are underused from that perspective. But it's also the aesthetic client, the person who is getting these non-invasive aesthetic procedures, is also the same person who is getting the teeth whitening, the veneers, who might be getting different procedures from different physicians, obviously from an aesthetic standpoint. So it's a great trickle over of referral opportunities, of patient growth. It's more foot traffic in, through your door, not an overwhelming amount, but it's an opportunity for a diverse array of specialties to collaborate and benefit from that patient growth, client growth opportunity.
Are you seeing it? And this is a question I just, as I was thinking through the process here as a space owner, when it comes to like front desk management, does your front desk, are they same front desk typically handling, the intake
Mhm.
of a patient that's, somebody that's leasing your space versus your traditional patient? How are most groups doing that?
Well, you bring a good point to surface. A huge, concern by a lot of space owners, space leasers, is what sort of liability am I incurring by allowing these outside renters,
Yep.
practitioners in my space? Because the last thing anybody wants to take on is more liability
Yep.
based on what is happening in their owned or leased space. So what is great about our platform is we cover them on that liability. Practitioners who are renting spaces through our platform are providing all of the regulatory requirements to be independent practitioners. So, medical director oversight, malpractice insurance requirements, and terms and conditions that put them as the accountable practitioner, the liability behind what they're doing in these spaces. This practice is HIPAA compliant. The space
Mm-hmm.
owners, the space leasers cannot see who these patients are. They don't know what procedures are happening. They are not controlling and managing payment processing for these patients. So um, that's a huge value to a lot of our space owners to venture down this path and offer this opportunity, because they are truly, in theory, glorified landlords of the additional users of their space. Um, does that answer the question? So,
It
in
does. Yeah.
theory, the front desk person really doesn't play a role,
Yeah.
right? The user of the space is responsible for their patient, their client experience. They are not leaning on or taking, demanding extra needs of the space owner.
Yep, that you answered it perfectly. Is one thing that popped in my head is, I love the depth you went into there. Is keeping it compliant, keeping the liability away from the space owner,
Mhm.
etc. Yeah, really, really cool. So
Mhm.
let's talk about your primary client on the other side. Is, you mentioned this, individual providers,
Mhm.
primarily in the aesthetic space, or,
Mhm.
I believe, at least, for now. But talk about how you've supported them some of the benefits they're gaining, beyond not having to carry a lease. I know that's a big part of it, but I'd love to hear more about that.
The success of this model really resides on the demand and the user of the space. A huge marketplace of growth that we saw a need for space access and product access was the aesthetic injector marketplace. When
Yep.
we launched this platform, when we launched this business model 6 years ago, it was primarily going after that specific practitioner. We see a lot of alignment with the aesthetic injector and the hair care industry. Hair salons have been renting chairs for years. Hair salon owners know that the relationship with the client resides between the beautician, the stylist, and their client,
Yeah.
not the hair salon. So patient loyalty, patient traffic follows the practitioner, follows the provider where they go. So why not empower that provider with the opportunity to practice independently? It's very much so in the aesthetic injector marketplace. The one of the biggest pain points of med spas is a revolving door of employees. Keeping those employees when they know they could be making, instead of a 20% margin with them, 25% margin at the med spa next door.
Yeah.
And so under this platform, aesthetic injectors are in full control of their profitability. No one's taking from their procedure revenue. They control when they work, how they work. The access to product and space is what we are empowering them with. And when I say product, it's injectable product, which is prescription based, injectable product, which is supported by the supervising medical director that they are required to have. And so that was the initial marketplace we were trying to fulfill. We've seen a huge tremendous amount of growth in the 6 years that this business model has been in place, and we're now leveraging it. What we've seen in the last 2-3 years is more practitioners entering a shared space model marketplace. So the bulk of our renters are aesthetic injectors and nurses and nurse practitioners, and RNs, but now we're seeing concierge physicians who are primarily doing the majority of their support via telehealth, but from time to time, they need a space with which to treat or see a client in person.
Yeah.
We are seeing multiple practitioners in the healthcare and wellness space as well, nutritionists, dietitians, IV hydrationists. So the shared space model, I think post the pandemic as well, people are looking to really reduce their overhead and
Yep.
increase that margin for themselves and reduce the risk. And space owners are looking to diversify their biggest asset and generate revenue for that, which is their real estate, their lease, or their mortgage.
Yeah. The other thing I love, if, an independent, provider, an injector, to your point, you said it here, and the industry knows this, but patients are loyal to that injector.
Mm-hmm.
So if, as an injector, if you're building up a good reputation as being somebody that people want to go to, this allows you to maybe open up some business in multiple markets, right? You've got, multiple areas close, and you can spend some time here on certain days. It expands your opportunity at clientele and the base that you can tap into for revenue.
Exactly. So it's a win for both sides. As an independent practitioner, you're not taking on more overhead risk. As the space owner, you're able to leverage an opportunity for multiple users, and our software platform controls, and not controls, I would have to say, but manages and efficiently schedules all of the users of your space, so you're not dealing with that, but you have full autonomy as to when your space is available, which spaces, which exam rooms, all of them, one or two of them are available, when, how.
Right.
And so you do not lose control of who is in your space, when and how the space is being used. And so that ability to have that sort of oversight is important as well.
Love that. So we're coming up close to time. One question I wanted to ask is, current status of Cloud Med Spas, where, I know I don't know if you consider yourself nationwide yet, but where are you primarily, based right now, where you have a lot of space owners and providers? Where are the markets you're looking to expand into? So those that are listening, if they're seeing this as an opportunity, we'll talk about how to contact you, but I would love to kind of know, where are you at currently in the regions of the country, and where are the opportunities you're pursuing?
Sure. We're in 17 markets nationally currently. We're looking to be everywhere. When we have a client that come to us who owns a space or has a space, we always say your target audience is the practitioner, not the patient, right? So you want to, if you happen to be in a location that is near other aesthetic based practices or other independent practices, that's a great place to be in. It's
Mhm.
not a saturation because you are pulling potential renters and practitioners from spaces where they could come next door, earn 5x what they're currently earning, and
Yeah,
the move and the change is huge disruption for them
that's
and their
exactly
patients or clients. So, we do see our more urban locations doing very well, suburban locations doing very well. Rural is a little bit more of a stretch and an
right.
opportunity because you clearly want to make sure you have the users of your space. But we really support all of our clients with the onboarding process. You are not dealing with a bot to support you. So we pride ourselves on really good customer service, training and education, collaborating with partners like you guys, Jeremy, to constantly keep all of the practitioners in our network well informed and educated
Yep.
about best practices. So it's really an ongoing relationship. We're constantly adding to our platform and the value opportunities of what we bring to our clients. And so, um, yeah, it's a transparent, very collaborative, straightforward opportunity, and our clients' testimonials speak to that.
Yeah. So for those that are space owners or providers that are interested in pursuing an opportunity here, what's the best way to get in contact?
So I'm a great contact to start the conversation and do a little, digging and finding out if this is something you want to pursue. And so it's great. Every client approach is unique to their needs. So there's not sort of, uh, you know, one sort of outfit for everyone. So we really sort of cater to each specific client's needs. My email is Shannon, SHANNON, at cloudmedspas, that's plural.com. That's a great way to connect with me. Shoot me an email. Let's schedule a time to initiate the conversation. And knowledge is power. So figure out if this is a fit and if this is something that would work for your business or your practice.
Love that. I'm excited to watch your continued growth. What did you say? The Airbnb of med spa,
Airbnb of healthcare and wellness.
healthcare
Yeah.
and wellness. That's what
Yeah.
it was. I love that. So
Yeah.
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 Well, I'm really impressed with what you've established and set up, and I obviously you're having some success already, and I know that's going to continue because it's a unique model that is needed. I can see the benefits for both sides. So thank you, Shannon, for being on today.
Thanks, Jeremy.
We'll have to have you on later and see the trajectory of growth here in the coming months and get some additional updates. Would love to do that
Great.
again.
Yeah, I would love that as well.
Okay. Thanks, Shannon.
Thanks.
Thank you for tuning in to this episode of the Healthcare Connections podcast. For more information on the topic we covered today, you can reach out to me or to our guest. For any additional information on healthcare compliance pros, feel free to email me at jwin@hcp.md. Don't forget to tune in next week. Thank you.